Good evening, everybody. So tonight's live stream is all about shin splints. I'm going to talk about what causes shin splints, how you can be sure that you've got shin splints and not something like compartment syndrome or even a stress fracture. And then we'll look at what you can do to fix it. And then lastly, we'll take a look at how you can prevent it from coming back in the future. Welcome, my name is Maryke, and I'm the physiotherapist at sportsinjuryphysio.com. If this is your first time here and you would like to learn how to stay injury-free, make sure to subscribe and hit the little bell so that you don't miss any of the updates. So what causes shin splints? Now, shin splints is essentially an overuse injury. It's an overstrain of the bone. We aren't quite sure exactly why it happens. There are two theories at the moment. One is that it is excessive pulling of the soft tissue, the muscles on the bone where they're attached to the bone, that causes it to strain. And the second theory is that it's the bone itself that's under too much strain and causes the stress reaction in this bit of the shin bone. It doesn't really matter which one of those are the true reason. In my personal opinion, it's probably a combination of them, of the two, because what I find in practice is you've got to actually address both if you want it to get better. Now, the important bit of that waffle that I've just done there is to understand that it's an overuse injury. It happens when you do not give the muscles and the bone enough time to recover from what exercise you've just done with them. So overuse can be caused by either doing an activity that you're not used to and too much of it too quickly. So for instance, one of the people who asked a question thinks his case of shin splints was brought on by doing a hopping activity that was new to him. So what that can do is, if you do a few hops and it's not too much more than what your bone and your tissue can handle, then you just recover naturally. But if it's too much in that one session, then you can actually go through a breakdown phase. What may be useful for me to explain first is, remember, when we train, when we exercise, you create micro trauma, and that micro trauma is in your muscles, your ligaments, your bones. Anything in the body that you use will get a little bit of trauma, and that's okay. That micro damage is actually necessary for the brain to then go, oh, you need that stuff to be stronger, so I'll rebuild it stronger. And that recovery process takes anywhere between 24 to 48 hours, and even sometimes longer than that, depending on how fit you are, how used you are to exercise, what type of exercise you've done. So if you then give it enough time to rest and recover, the next time you train, you are now stronger and you can do more. If, however, you train before it has fully recovered from that damage that you've given it through the previous exercise bout, you actually create damage on damage, and that tissue isn't as strong as it was before the previous session. If you do that often enough, you get an overuse injury where the tissue then breaks down and causes a proper injury for you. So you can see how training load plays a really important role in developing shin splints. One of the most common, so my physical physio practice where I work is located in the University of Brighton, and we see a lot of the students who attend the university. And one of the busiest times for me where I see a lot of the guys with shin splints is when they come back from summer holidays, not really done that much training, and they go right into hockey, football, you name it, and they do three sessions of it suddenly per week. They're not used to sprinting, they're not used to running even, because some of them have just had a lovely summer's holiday. And that's a classic time that they overstrain the muscles and the bone and everything, it's not used to it, and then get shin splints. Oh dear, Eleanor says, I have a grade 3 stress fracture and an ungraded one. Oh my dear, okay, you've got quite a few injuries recently. We'll talk about stress fractures in a minute, because they can actually lead on from shin splints as well. Good, so the first thing then for overuse is if you up your training too quickly. The second is if you up the intensity of your training too quickly. So a good example of that for runners is you've been running regularly and then you decide, okay, I'm going to start doing some sprinting sessions and I'm going to start adding in some hill work. So you may have been okay if you added in just one track session a week. You may have been even okay if you added in a track session and a hill session about 2-3 days later. But then you may end up running too many sessions too quickly or too hard sessions in 1 week. And that again can cause the tibia or the muscles to overstrain. Okay, so those are training errors. Then the second group of errors or things that can lead to overstrain of that area is biomechanical issues. Biomechanical issues refers to how the body moves. So I wonder if I can demonstrate this. If you can see, not really there. Let's see if I turn this side on a bit. Yes, that's better. So if you can see my leg, now imagine I am running, so my leg's going up and down. If it goes in a straight line, I'm placing my pressure through my leg and through my foot in a way that all the structures takes the strain. If, however, when I run, my leg turns in excessively or adducts so that it crosses the midline, then I will put different strains through my bones and even my foot, and that can lead this part to overstrain. Also, if your foot rolls in excessively while you're running, I wonder if I can show you my foot there. Yes, I can. So if when I run and I step, my foot does that, can you see how my center of gravity is going to go through this bit of my tibia or my shin bone more? And that can then cause it over time to overstrain as well. So instead of it being an issue with your training load in that case, it may actually be the way that your leg moves that causes the shin splints or the overuse of that bone. And again, that can have several reasons behind it. It can be that your hip muscles aren't strong enough, so they're not controlling your leg properly. It can be that your ankle muscles or your foot muscles, like the tib post, isn't strong enough, not controlling your foot properly. It can even be that your trainers aren't supportive enough or they're too soft and they allow it to roll in more. What else can cause it? It can be that you did a really long race and you got really tired by the end of it, and then you just let go and your legs just collapsed in, and therefore it strained it. Where normally your running style could be maybe good, but when you get tired, you may lose your form. So those are instances of where your biomechanics can cause trouble. Then the third category of people with shin splints that I see is due to general things in their life that's affecting their bone health. So remember, shin splints is essentially a stress injury of the bone. It's not quite as bad as gone on to stress fracture yet, but it's the start of it. It's where the bone is saying, I'm not happy, you need to change what you're doing. Now, for general bone health, things like vitamin D is really important. Vitamin D is a vitamin that we produce in our body in reaction to the sun UV lights shining on our skin. Now these days we're spending more time indoors, we're whacking sunscreen on because we don't want skin cancer, and all of that stops us from actually absorbing enough vitamin or creating enough vitamin D. Then also, if you live like me in the UK where we're really far away from the equator, our sun is so weak in the wintertime that we can't get enough vitamin D from it in any case. So make sure that if you are spending most of your time indoors, and especially if you live around the areas where I live, where you're far away from the equator, you may need vitamin D supplements in the wintertime. But the GPs are quite good this side. They do tend to test people's vitamin D levels these days. So if you are worried about it, just go for a blood test and see where you're at. Then the next thing that's important for bone health in athletes and active people is diet. And I'm not just talking about getting enough calcium in, which you can get through either dairy products or even loads of vegetables got it in. Most things like orange juice and breakfast cereals these days are fortified with calcium. But I'm also actually talking about eating enough food. So that's a big problem for endurance athletes often, because you've got the thing where if you're really light, you perform better because you're lighter and you run faster. But if you don't eat enough calories to replace the stuff that you're burning, then your body actually goes into starvation mode. And what happens is it decides to then, our bodies always want to survive. So it's going to try and keep you alive by switching off the systems that it reckons you don't need. And what it does then is it stops your bones from rebuilding. It, for females, we usually notice it because our menstrual cycle stops or goes haywire, or you miss a few months. And that's all signs that your body is really struggling to survive. It reckons you're in starvation mode, and it's trying to kind of allocate the calories or the energy to where it thinks it's most needed. So, and there's good evidence now also that even for men, if they restrict their calories over a long period and they exercise intensively, they can really put themselves at risk for stress fractures. So make sure that you're eating enough and that you're getting vitamin D and you're getting calcium. Then lastly, also sleep is quite important. So if you're having a hectic schedule with work, or you're working night shifts and things, you have to make sure that you get a regular sleep pattern. I don't know if you guys saw, but there was a really good program about sleep on the BBC. Was it on BBC? I think it was, may have been ITV4. I don't know, but it's on iPlayer still. See if you can see it, find it. It really gives good advice about how you can rectify your sleep patterns, or how you can optimize sleep by playing with light and blue light especially. Okay, so there's more questions coming through. Let me just have a quick look. Okay, that is fine. Leanne, I'm definitely going to answer that for you in a minute. And let me just see this one. Okay, and I'll definitely, Lisa, I'll be answering your question as well in a minute. And then Dara is asking, can improper runners be a cause? So by runners, do you mean trainers? If it or running shoes? Yes, definitely. Running shoes can contribute to this. It can either be ones that's too flexible, so they cause your foot to roll in too much, which can cause more strain on that bit. Or it can be ones that's actually too rock solid hard, depending on your body type and what, especially if you're doing a lot of downhill running. So if your gut feels saying there's something wrong with the running shoes, then it's actually worth getting somebody to video you while running. But I'm a firm believer for following gut feel. If your gut feel says your trainers aren't right, then they're likely not right. Okay, so that is all about what causes shin splints. But now let's just quickly take a look at making sure that you definitely have shin splints. So the definition, or the medical definition of shin splints, is the following. Let me show you my foot, then it'll make more sense. So the pain from shin splints is usually, this is your tibia or shin bone, okay, and you can run along that. If you come to the inside, you'll feel that, okay, that's the border of it. And the pain you feel from shin splints is usually between this point and that point, somewhere along that line. And it's quite a large area usually. Now, I often struggle with symptoms that want to come on because I've got silly flexible feet. And if I don't do my strength training, then I can struggle with it. So for me, even though I don't have symptoms at the moment, if I press this area, I can feel it's quite tender. The research says that in order for it to be shin splints and not something else, it's got to be quite a large area that is tender when you press on it. So 5 centimeters or more. In the early days, it may be that when you feel it a little bit after training, you can often run through it, that it goes away, then it comes back. But as it progresses, it may stop you from training, that it's immediately painful, and that the pain lasts quite a few days after and can be painful just with walking and things like that. Now, a stress fracture is usually a much more focal point. So it's a smaller area that's really specifically painful along this line. And it often causes you pain at rest. So if you're lying in bed and you're thinking, oh, that's really aching, then you need to be careful, because that is turning into more than just shin splints. Also, if you feel this anterior, you've got this this really nice sharp bit of the shin bone at the front. So we're not talking about the side, we're talking of the front, and we're not talking of the muscly bit there. We're talking about the bone line you can feel at the front of the shin bone. If you've got a focal point on that that is causing your pain, again, that is not shin splints. That may be a stress fracture in that. And if that is the case, then I would really actually go and see an experienced physiotherapist or a sports physician, somebody like that, because you really need to be looking at whether that's a stress fracture or not. And on that point, X-rays are useless for this. X-rays does not show stress fractures. MRI scan is the only thing that shows a stress reaction in the bone and a stress fracture. You will often find that stress fractures are not visible on X-rays, and only in advanced cases where it's properly gone and fractured the bone, then you can see them. So in the early stages, X-rays really don't show that. Let me just see if I've missed anything for that. No, so the big difference between a stress fracture and shin splints is the size of the problem. If it's a very large area that's painful and there's not one specific point that's more painful than the rest, very likely you've got shin splints. If it's one specific point that's really tender and painful on the bone, not in the muscle, then it's much more likely that we're going towards a stress fracture. We don't stress about stress fractures on the inside of the tibia so much, or the shin bone, because if we give them the right type of treatment, they often recover quite quickly. We're more worried if that point is on the front of the shin bone, then you want to act quite quickly. Okay. Then the third thing that you want to look at is this maybe compartment syndrome? Now, I don't know if you've heard of that before, but compartment syndrome is basically that as soon as you start exercising, our muscles swell a little bit because of all the blood flow and everything in that. Our muscles are all surrounded by thick fascia, so it's kind of got sheaths around them. That's the white sinewy stuff when you, if you've ever seen raw meat, that's fascia. So normally our fascia can expand enough that it's not a problem. But for people with compartment syndrome, that fascia is too tight. And actually what happens then when the muscles swell from the exercise, it cuts off the blood circulation. So if your shin splint type symptoms are accompanied by cramping in your calf while you're exercising, or pins and needles, numb sensations, your foot may feel cold, tingling, anything like that, and it all settles quite quickly after you stop exercising. So within 15 minutes of stopping exercise, the symptoms are gone and actually everything feels quite fine. Then it's much more likely that you've got compartment syndrome. You can have the two together, so there may be pain that actually lasts longer. That doesn't mean that it's not compartment syndrome, but what I would say is if you get any cramping or pins and needles, tingling, something like that while exercising, you don't just have shin splints. You definitely then need to be checked out for compartment syndrome as well. Okay, and then the last one is tib post tendinopathy. So your tib post muscle, tibialis posterior, runs, let me show it like this, comes from the back of the calf as well, very, very deep layer, runs on the inside there, comes around there and attaches into that bit, and it stops the foot from turning in. Usually when you have tib post tendinopathy, the pain is around the inside of the ankle, but it can go up along this side as well. You can have shin splints together with tib post tendinopathy, and again, it doesn't really matter to make that distinction too clearly, because the treatment is very much similar for both of them. Okay, but the big thing you want to distinguish between is it just shin splints, or could it be a stress fracture, or could it be compartment syndrome? Good. Then, how do we fix it? The key to fixing it lies in identifying what's caused it in the first place. But the most important thing that's similar for, doesn't matter what it caused it, is that you have to give it rest. Remember, it's an overuse injury. Continuing to exercise or doing the exercise that aggravates it will not help it heal. It will just actually make it continuously painful. Okay. But don't worry, it doesn't mean you can't do anything. as you know, I'm very much for relative rest. Relative rest means you have to identify the things that is aggravating it, cut that out, but do any type of exercise you want as long as it doesn't aggravate the injury. So let's think of practical examples. If it is that running and jumping causes you pain, but walking is absolutely fine, then you can still walk. If even walking doesn't really work, or standing in one place can often still be painful, then you may have to go for cycling or swimming or cross trainer, something like that. But anything that can keep you cardiovascularly fit while you recover. Now, I know if you're a runner, you don't really like cycling, you don't really like swimming. But you know what? If you can keep your fitness up while you're waiting for this to recover, because it's going to take, if you're lucky, it takes 6 weeks. If you've neglected it for a long time, it can take 3 months or longer. So it's important to catch it in that first early stages when it happens. And honestly, you'll drive yourself nuts if you don't do exercise in the meantime. And secondly, if you're totally unfit by the time you go back to exercise, you're going to have to start really, really slowly. So figure out what type of activities aggravates it and cut them out. Then second is, let's look at what caused it. If it is, so we'll talk about the training in a minute because we're going to come back to that, because you're not going to do your normal training in any case. You've got to cut it back at this point. I'm going to jump onto biomechanics. So biomechanics, remember, is how your body moves. It's about when you run, when you jump, does your legs move in a lovely straight line? Do you have proper pelvic stability? That to show you quickly what that means again is, remember, imagine now that I'm running. When I run on one leg like that or jump, your pelvis is meant to stay level, so no dropping of it. Your knee is meant to move in line with the middle of your foot or your second toe, and your foot that you're on is not meant to roll in. It's meant to kind of just gently, it's got a gentle roll in, but not an excessive roll in. So if any of those factors is a problem or was identified as possibly a cause for you, then you have to fix that. And you can fix that through strengthening up the glute muscles, glute max, glute med. I've done previous sessions on how to do that. And you know what? I'll put links for you in this, as well as in the blog post. I'll put links to where you can find exercises for that. You also want to strengthen things like your quadricep muscle. Remember, when you're running, your quads are meant to take 60% or absorb 60% of the force from running. So if your quads aren't strong enough, then other structures are taking more force than what they should. It's a very good time to work on your foot muscle strength and your stability around your ankle. So look at all of those and get a nice strength training program for yourself, so that it will also help you feel as if you're actually doing something positive while you're waiting and resting the injury to recover. Now, there are plenty of ways to strengthen your glutes and your quads and stuff, but you have to choose exercise that doesn't aggravate that leg of yours that is painful. Don't just, people often feel that they just want to go in and stretch the calf muscle and really strengthen the calf muscle. It's too late at this point to do that. And if you do it excessively or quite strongly when it's as painful, you will likely just flare it up. So ease off that, work on the muscles far away from that site first. In any case, what I find in my patients is some of them are really tight, and the excessive tightness around the calves and things could have contributed to it. And once it's calmed down, they really respond well to stretching. But another subset actually are too flexible and their ankles move too much. So stretching them really doesn't work that well. They need strength training. Okay, so identify which one of the two you are, and to be honest, even if you're on the tight side, you can probably still do with strengthening your glutes and things up. Then second thing is, if your foot rolls in too much, you may definitely benefit from checking if your trainers are right, whether you need trainers that's a little bit more stable. So example off the top of my head that I can think of is Asics are usually a lot more stable than Nikes, but again it depends on the specific type of Asics or Nikes. It may be that you even could benefit from orthotics. I know Glenn mentioned earlier in the group that he really helped his compartment syndrome with orthotics, and that's what I also see is, especially if you've got a foot that's really flexible and an arch that's really flat, doing the exercises is fine, but it takes so many months for them to be proper strong that using orthotics can be a kind of a quick fix to add in there that you can get back to running before the ankle muscles are properly strong. Then we're looking at, so stretching I've talked about a little bit. If you're somebody who are excessively tight, you may benefit from stretching, but please don't stretch painful things while they're still painful. They need to be pretty comfortable before you try stretching them. You will find in any case when it's really flared up, that tightness that you're getting will not go until it's calmed down. It is feeling that tight because it's irritated. Okay. Okay, and then one of the most important things is once it has calmed down, it's about the slow return to activity. Now, you cannot go running unless you are absolutely pain-free walking around. If you're absolutely pain-free walking around, you have to test it whether it's happy with the higher impact. So what you do then is you jump up and down on one leg 10 times and see is that pain-free. If that is pain-free, then you can actually consider a run-walk. Now, you'll notice I'm saying run-walk, not a run. If you go directly into a run, it's not going to work. It may be too much for it to continuously run whatever you're used to running. You've got to ease into it. So what you do is you do 1 minute run, 1 minute walk, 1 minute run, 1 minute walk, and you do that for 10 minutes. That's it for the first session. Now I know you're going to go, 10 minutes, that's not worth putting my trainers on. But you know what? You need to check the 24-hour response, because often something is not painful while you're doing it. It's only the next morning when you get out of bed that it says, "Hoi, really didn't like what you did to me yesterday." And if you get to the point where it's already painful while you're running, it's too late to stop then, because you've already pushed the tissue then into the bit where it goes, yeah, not strong enough yet for this. I haven't recovered enough for this. Okay. Good news is, if that 10-minute session was absolutely fine, 2 days later, you can do it again and you can add 2 to 4 minutes onto that until you get to 20 minutes. So every time that it's fine and you get no reaction, 2 days later, you can add more time to it until you get to 20 minutes. At 20 minutes, if that is absolutely fine, then you can start running for 2 minutes, walk 1 minute. That fine? 3 minutes, 1 minute, until you get to a continuous run of 20 minutes. But it's so important to, every time that you feel, I'm not sure about this, you turn it into a walk session. You don't push it further. Now, usually what I find is, if my patients have been patient, and they have waited until they could walk pain-free, and I'm not talking one day, I'm talking consistently for at least a week or 2 weeks that you have no pain with walking and standing, and they've done the hop test, that's fine, and they start the run-walk program. The run-walk program can often take as little as 2 to 3 weeks where you get to your 20 minutes continuous running. And then it depends on the person and how long you've had the injury for, how quickly you can get back to your normal training. It also depends on what you want to be doing, what your normal training is. If it is just running a 5K, that's quite easy. If it is that you want to do ultra running, then that's a little bit more challenging, and we may have to think about how we do that. And do we want you to get you doing some of your running in the water or things like that? But yes, slow return to running. So if I could give you an example of somebody who is a hockey player, for instance, if you wanted to get back to sport, you have to be able to jog first before you can sprint. Then you've got to be able to sprint before you can do changes in direction. And I would say that you've got to be able to run 2 miles or so, 3 miles easily before you can think about putting sprints into that. But there's really no recipe with that. It's about following, working with somebody who actually can guide you a little bit depending on how you react to the exercises. Now, you'll notice that I've not spoken about massage or dry needling or anything like that at all. And that is because, yes, those things can be useful for pain and getting rid of some of the muscle spasm. But I want you to be careful of massage in the early stages. If it's really inflamed and sore and somebody goes and digs in on that, they will make your pain worse because they will just cause more irritation. So gentle treatments is okay. Dry needling can be quite useful to take some of the spasm away as well. But the thing that will fix it is if you strengthen the muscles up that need strengthening, and if you take the load off the stuff that needs to be offloaded, and if you do that slow return to sport again. Your body is good at fixing itself. Nothing that I as a physio can do with my hands can make you produce new cells. Your body has to do it. And for it to do it, you've got to create the right circumstances there. What I would say is it is really useful seeing a physio or somebody who is good with sports injuries because they can help guide you through your rehab and get you to do the right things at the right time. Okay, so let me answer some of these questions before we go on, because I feel that that would be useful at this stage. Okay, so I used to run Leanne says, I used to run a lot, then I got shin splints, gave up for months, went back for a run, and have them again after one run. No! What am I doing wrong? So Leanne, I would want to know, did you actually fix the problem that caused the shin splints in the first place? Do you know what caused it? Was it your shoes? Was it the way you run? Was it how much training you did? Is it the terrain you run on? This first run that you did, how long was it for? Maybe if you tried a run-walk program, that would have been different. So those are the type of things that I would want to look at. The other thing is also, with regards to running style, I forgot to say this, is there's some evidence out there that if you overstride, so you give really large steps, or if your steps are quite narrow, so when you run, often you'll find that your ankles can touch, or your one foot kicks your ankle. That means that you've got quite a narrow running style. Those type of things can actually cause the tibia to overstrain as well. So things that you can do while running, cues that you can think of while running to help you with that is to think about keeping your strides a little bit shorter, light-footed running, so not hearing yourself go plonk, 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 and also trying to keep your knees pointing forwards and just a bit of a gap between where you put your feet down. So thinking about not being on a tightrope. But yes, Leanne, if that was mine, I would really want to go and have a look at your feet, everything. See if you can identify what is causing yours and if you've actually addressed that. And then also, it may just be that you need to actually follow a run-walk program and not just go in for a continuous run. Okay, it can be hard because in your mind, especially if you're fit, that you've kept up your fitness and things, it's hard to go out for a really short run because cardiovascularly, you may be able to do loads. Okay, then Eleanor, I have a grade 3 stress fracture in one leg and an ungraded one in another. Can't understand why pain is periodic. That is an interesting one. I can't answer you that without actually knowing your history very well, Eleanor. But what I would say is, if you've got 2 stress fractures, I would definitely want to check general things for bone health. So have your GP actually checked your bone density for you? I don't know how old you are, but especially if you're in your 40s, going to 50s, starting to go through menopause, then as females, our bone density may dip. If you've got any history of osteoporosis in your family, so if your mum's had osteoporosis, your grandma, anybody like that, you may be a high-risk person, and this may be a sign that actually your bone health's not great. Also, if you've had irregular menstruation cycles or things when you were younger, that can have an influence at this point. I've said vitamin D levels. Check your diet. Are you getting enough calcium in? Are you getting enough calories in? Those are just the things that spring to mind. But if you're having that many stress fractures, I would want to check the other factors that can influence your bone health. And also, if you haven't had a DEXA scan, which is the one that tests your bone health, then ask your GP for that. And I can write this in a message for you if you need the specific terms and things. Just let me know. Message me through Facebook. Okay, then Lisa, I experienced shin splints type symptoms after upping my running too fast. I've had a week's rest, but is this enough? Lisa, a week's rest is not that much. What I would say though is I would test it. How I would test it is I would go for a very nice short run, probably pick a grassy field or something where it's nice and flat grass, it's not quite that uneven, and I would definitely do a run walk session. So don't even think that it's a running session, think of it as just a test. Go do a run walk session. In your case, because you've not had it for a long time, and if the symptoms weren't that severe, you may get away with more than 10 minutes in total. But follow your gut feel. As soon as you start feeling anything more than a 1 out of 10, I think there may be something, then turn it into a walk session. Okay. I will also pop a link in this for you guys in a minute to an article that I wrote about a run walk program so that you guys can see what I mean by that, because I'm not sure whether I'm really clear about that, and you can download it also from there. But yes, a week's rest for shin splint type symptoms feels like an eternity, but it may not be enough depending on how bad it is. So the only way that you know whether it's enough is actually to go and test it. Then Dara, I think I've answered your thing about the improper runners. If it is trainers or running shoes that you mean, then yes, too flexible. Oh yes, you've said yes. Okay, Lisa, you're asking what's the treatments for compartment syndrome. It will depend is the answer to that. It was interesting today when I did my research again, when I just checked up on everything, that they still recommend conservative treatment first for compartment syndrome. And that is things like manual therapy, so massage, stretching, anything, dry needling, anything that can help to improve the flexibility of the fascia. But if it's true compartment syndrome and it's been going on for a long period of time, then they often have to go in and actually do surgery. So with compartment syndrome is they often go and they just have to make a little cut in the fascia, so they cut a little triangle out to allow the muscle to expand. But they have to do several tests and things first to make sure that it's truly compartment syndrome before they'll do that. Okay, then Rosie, I slipped my sole of my foot. I've had surgery to repair the tendons and getting stitches out in a week, and I was told to keep my foot elevated for 1 week. So can I put my foot on the floor now? Rosie, yes. So the big thing with that would have been that the swelling affects how much scar tissue you can get. So if you have excessive swelling, it can stop the healing process and cause excessive swelling. So what I would say is you can keep it down there for a little bit, but don't keep it there to the point where it really swells up. But the best person to tell you what to do and what not to do would be your surgeon, really. So if they haven't been clear, contact them. They should be able to tell you. Okay, so I can't really give you advice about what to do with the cast on because I'm not sure what surgery they did, Rosie. The surgeons are really quite pedantic depending on how much damage there was and how they do things. So they are the best people to give you advice about that one. Then Glenn, I had to give up long runs due to compartment syndrome. Yeah, that can be an issue. What I would say, Glenn, is did you ever see a sports physician about that? Because that diagnosis can sometimes be mixed up and they have to really test it, that they're sure they have to do pressure tests to make sure that it is true compartment syndrome. Okay, so Facebook is having a meltdown again on me. I'm going to wait for it to load. I'm going to assume I'm still going on. So the next thing that I'm going to move on to is how do you actually prevent shin splints from happening then? So the best way to prevent it is to actually know what caused it in the first place. So unfortunately, the research does show that if you've had shin splints in the past, there's a big chance that you will get it again in the future. So if you're not clear as to why you had shin splints, go and see somebody who can actually help assess your biomechanics for you and look at your running style, look at the trainers you use, and test your muscles and give you specific advice about strength training and things. But if you're pretty sure as to what caused it, then I would say strengthening up your glutes, strengthening up your muscles, so making sure that you're getting 2 strength training sessions in a week at least, should be a good place to start. The second is make sure you've got supportive trainers, make sure you've got orthotics if you need them. Doesn't have to be expensive things. Off-the-shelf things from Amazon could be fine. Again, I'll give you some links to examples that I think is okay. Then one of the most important things is log your training and look at your volumes of training. I'm quite amazed sometimes that people who do loads of high level or high volume of training often can't tell me exactly what they do in a week. The problem with that is that we know if you increase your running by more than 10% in a week, you're actually predisposing yourself to loads of different injuries. So if you don't know what you're doing, you don't know where you've gone wrong. So take note of what training you do, take note of how many intense sessions you do in a week, and make sure you're planning enough recovery time between. And then lastly, look at all the things that can affect your bone health. So what you eat, how much sleep you get, how much vitamin D you get. Okay. Oh, great stuff. We're back on seeing the questions again. So let me be quick before Facebook decides to throw me out again. Okay, we've answered those. Okay, then Dara is asking, does ice have any effect other than acute pain reduction? They reckon that ice is not that useful after about 5 days. It is really good at controlling swelling and acute injuries, but it's really more for pain management. And it's a good alternative to using anti-inflammatories and things, because inflammation is actually needed in this process. We need it for the healing process. So we don't want to dull it totally, but we don't want you to be in excessive pain either. So if you're finding it useful, if you find that it's a good way of reducing pain, then continue with it. Okay, Leanne, yes, thought it was my shoes, and yes, was run walk. I'm 6 foot. No, it's jumped. Okay, 6 foot, so strides are long, but I turn in. Okay, so oh, that's depressing. So you actually did everything right. So yes, what I would say is then what I would do is I would look for some orthotics in the shoes then, and I would also strengthen the muscles around the ankle joint and strengthen the calves themselves, and also strengthen the glutes. That's where I would go. And then when you go running, think about keeping those strides very light and short. So yeah, just the easiest way to think about it is that you don't really want to hear yourself plonk down. Okay, give that a go. Okay, then Lisa says, thanks, after listening to this, beginning to think it's more likely to be compartment syndrome. Pain is more in front of shins. Nope, compartment syndrome isn't in the front of the shins, it's in the back of the leg. Front of the I guess you can get compartment syndrome in this bit as well, but if your pain is in this bit, in the muscly bit at the front, then it may be an overuse of the muscles at the front. So it could be down to have you run with new trainers, or have you run a lot of downhills, or anything that could have made you work harder to lift the front of the feet up. Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.